Did you know that once you deliver via C-section, you are eligible to deliver vaginally? Successful vaginal birth rates for women who plan a VBAC, vaginal birth after C-section, are high, 70 to 87% according to BMC Pregnancy and Childbirth 2015 edition. Some of us are moms, some of us are dads, but we have all been the one to give birth or know someone who has given birth before. I have been pregnant 4 times. My first 2 deliveries were vaginal deliveries with my own sons, 2008, 2015. My third pregnancy was twins. They were born via C-section. Because somehow delivering twins vaginally is still not seen enough. Now I'm pregnant a 4th time. I'm 36 weeks and I'm hoping to do a VBAC, vaginal delivery after C-section. I'm due in a few short weeks and I am a good candidate for a VBAC because I have proven to being able to give birth twice before vaginally without complications, and the C-section was necessary due to it being 2. The effects on the body are less detrimental than a cesarean section via VBAC. There are no sutures involved because there is no surgery. There is no scar left, and as women, we are a little bit vain. There is no risk of infection, which is of course the biggest issue, because anytime you have a wound, if it's not taken care of appropriately, you run the risk of infection. And there is no blood clots. Once you have a surgery, any type of surgery, you run the risk of having blood clots because you're not able to move as well. So you either have to get stockings to help you with the circulation, or you try to move the most you can. But if you've ever had a C-section or know somebody who has had a C-section, it's a little hard to move. Here are 2 of my visual aids. The first one is a scar right here. It's infected, and you can see it because it's reddened. It seems like there's purulent drainage. It has edema, which is swelling, and it looks like it's dehiscing, which means it's opening apart. That is not supposed to happen. The second picture are sutures. You can see how many of them there is, and looks a little bit big. Right here is another C-section. You can see all of the effects it has, how bad you have bruising. This one looks pretty clean, but this one has staples on them, different than the first one. This does take a little bit to heal, but still very painful. These right here are types of C-sections you can get. Vertical, up and down. Fenisteal, lower. Low transverse, which is just across the tummy. Low vertical, which is again up and down, but across the lower abdomen. And the last one is the classic incision, which is in the middle by the belly button. pain meds given to C-section patients are usually Schedule II narcotics, something like Demerol. When you get a VBAC, vaginal birth after delivery, you usually get something over the counter, OTC, like some ibuprofen or some Tylenol, because again, there is no surgical procedure involved. The recovery is less than a C-section as well. It takes 24 hours for hospital stay when you have a vaginal delivery, which is the same time as a VBAC. It takes 3 to 4 weeks of recovery at home to return to your regular work routine or exercise routine, or just be able to move in general without much pain or uncomfortness. A VBAC is also way more affordable, and you are able to do home birth or water birth. It decreases hospital staff, hospital stay, and pharmaceutical interventions like the Schedule II narcotic medication I mentioned, the epidural, any type of general anesthesia, or just simply getting cut. There is no rental of the operating room, which decreases the amount of money you will pay by a lot. This right here is my visual aid of a water birth. This graph right here is my visual aid stating that not many women are eligible to either get a VBAC, but the ones that do don't really want to get one simply because they either think a C-section is more comfortable, they are ineligible to do one, or their doctor just says, let's just do one since we've already done one before. But the rates are high. This is a graph from 1997 to 2008, where it shows that most women still don't explore the option of getting a VBAC. Having a VBAC benefits your body by decreasing the effects a surgery would have on it. The recovery time is shorter, and you can return to your lifestyle sooner after giving birth, and it is, of course, a more affordable procedure that does not require surgical interventions of any kind. Educating yourself and exploring your birthing options is a favorable option to ensure you are making the correct choice that could impact your life positively. A VBAC can mean the difference between being able to deliver more children of your own or the doctor telling you it is no longer safe due to multiple cesarean sections, since 3 is the average any woman can get and the safe number you can have. So if you have an option of getting a VBAC, vaginal birth after delivery, I would suggest you explore that option more thoroughly with your partner by researching it and talking to your physician about it. Because if you're planning on having more children, but you've already had 3 C-sections, a VBAC would severely benefit you. Thank you.